All right. So Kathy Robinson with the Department of Health. She's the Director of Children's Special Services. She will be presenting on both CHANT and CSS for us today because Kristen was not able to join us. So thank you, Kathy.
Yes, thank you, Christina, for inviting me, and thank you guys for having me. I'm always excited to talk about CHANT and especially Children's Special Services or CSS, as that is the program that I am most aligned with. But we do work hand in hand with CHANT, as Christina alluded to. Kristen Gentry, which is the program director for CHANT, she was not able to be here with us today, and so I'm excited to present in her absence. As I am just so happy to speak to you guys on Chant and CSS. I'm going to start today, and I put that children and youth with special healthcare needs, as that is the section that both Kristen and I work under. And so, with that being said, we are both colleagues. And so I just wanted you guys to know that we're still on the same team, that even though she's not here. So, what does CHANT stand for? As Serena indicated, that it stands for Community Health Access and Navigation in Tennessee. You guys know that with public health, we really do love those acronyms. But just to give you a bit of history on CHANT, it asked it actually derived from the integration of three programs that was previously with the Department of Health. And those three programs were Tender Care Outreach, Hugs or Help Us Grow Successfully, and of course, Children's Special Services or CSS. We integrated those programs because we discovered that a lot of we had the same clients with those programs. So Hugs may have been going into a home, CSS may have been going into a home, and those may have been two separate home visits with the same person. And so we got together and determined that we could do the same and perform our jobs if we had one program. So that's why we integrated. And so we came up with this definition of CHANT, and it's a voluntary care coordination service offered through the local health departments. And I think that that is one thing that we really need to understand about CHANT, that it is voluntary. We get so many referrals for CHANT from different organizations, and many of them have the perception that parents must participate when the referral is sent. But no, once we complete a screening and assessment with the family, we inform them of the things that we are presented with, that some social services that the families have available that we can connect them to. And of course, the question that we ask is, are you interested in proceeding? So again, families do have the autonomy to say no, or they can say yes, that I would like to proceed. Again, we gather that information from the screening and assessments. We conduct it with the families from the referrals that we get, if they do answer the phone, or we can do it face to face as well. But those are conducted to determine the family's needs. And from those screening and assessments, care coordinators connect families to the available resources. Next slide, please. All right. And what is the purpose of CHANT? The purpose of CHANT is to identify and address those risk factors at the individual, family, and at the community level. Another thing about those three programs before the integration of CHANT, that we often found ourselves working in silos. For instance, CSS mainly only covered the needs of the families at the individual level. Um, Hugs would handle would assist family with resources at the family level, and Tender Care Outreach at the community level. So with the three programs integrating, that makes us able to assist the families in one location at the individual, family, and at the community level. And we also want to positively impact those overall health outcomes and those outcomes related to social determinants of health. Now, how do we do that? Because that is a large job, right? Making sure that families have what they need at those three different levels, at the individual, family, and community level. So we have multidisciplinary teams, inside of the health departments. They're composed of a care coordinator, a team lead, and sometimes we have managers even available. And for the CSS portions, we have registered nurses, which we also call our medical services leads. But they work within the communities that are more likely to have those poor health outcomes, and they address or they navigate those specific needs. And we also measure those results, and that's how we gather our impact. To expound on that, our staff provide care coordination to assist those families to meet their identified needs. So if a family doesn't have a need of, let's say, tobacco cessation, of course, that's not something that we would assist them with. It has to be something that is identified as a need through that screening and assessment. And we help the family through, again, home visitation, community visits, or phone calls. And I'm happy to say that CHANT is available in all 95 counties in Tennessee. And most importantly, it is free. And again, it is voluntary. Next slide. So who does CHANT serve? Of course, pregnant and postpartum adolescents and women, children birth to 21, children and youth with special health care needs, families and communities, and of course, at-risk children under the age of 5. Next slide. The goals of CHANT, which is so important, and that is to increase the awareness of the importance of primary prevention, and that's when we come in with those EPSDNTs, improve access to care. We really want to make sure that our families at the individual and the community level has access to medical and dental home and those social services. Where there are not services, perhaps in some of those smaller counties, we will work to make sure that if there is a neighboring county, say for instance, there is someone with a dental need and there is not a dentist in that county that may be able to see them, or the dentist has a wait list. If there is a neighboring county close, we will inform that family of that and make their referral. So again, our task is to make sure that we're giving the families what they need. We coordinate the services for children and youth with special health care needs, and that's when the CSS portion comes in, and we'll talk about that a little bit later. We want to improve pregnancy, birth, and maternal child health outcomes. I'll also talk about that a little bit later in a special project that we have currently. And we also want to work to positively impact those outcomes related to the social determinants of health. Now, that is a lot, as you guys could imagine. And with that, of course, we have some challenges, just like I'm sure that some of you all do. Of course, staffing at the local and regional level with those vacancies. We have problems like with retirements, new hires, and those individuals that may find other employment opportunities. So we're really working to make sure that we have that continuity of employment to ensure that our clients can have like that continuity of knowledge within those local counties. Unfortunately, another challenge is our current data infrastructure. I'm not sure if you guys are familiar with PTMS, but that is the state's billing and tracking system. But it is a very old system. In fact, the state is working to replace PTMS, and we are working trying to find vendors that may be able to provide those services that we conduct through PTMS, which is billing and tracking. And of course, RedCap. This is a system that we received through, it's something that Vanderbilt created, and is more so of a tool used for surveys. But currently, CHANT and CSS, we're using it for our data tracking, and it's just becoming really heavy with information, and so that slows it up. So it really slows our processes sometimes when we're working with families. But we're also working on something else that may help us with that as well. And of course, we have the need for interpreters in certain areas of the state. So we're working on that as well. Next slide, please. Some of the key stats that I would like to share with you guys today, and this is something that we really do consider a success for CHANT. Again, the 3 programs integrated in 2018, and just some of the data that we've been able to retrieve from that is that there have been almost 80,000, there have been close to 78,000 unique referrals from multiple community resources as of late February 2025. Also, since July 2018, over 58,000 unique families across the 95 counties in Tennessee have been screened through that screening and assessment. And 58 of those families have been enrolled in service because, again, remember that this is voluntary. So families can go through the screening and assessment and still share with us that they're not interested in participating right now. But again, those same families, they can come back at a later time. It doesn't mean that you are, forever banned or you can't participate in CHANT ever again. That referral can come back, that organization can make a referral, or the family can contact us again and say, hey, when I spoke with you guys in December, I wasn't ready to participate, but now it's been a couple of months, things are settled, and I would like to participate in the program again. Our data collection, which is so important to the work that we do, and I'm sure with the work that you all do as well. We collect our data through that red cap system. And this was not possible before the integration, as again, a lot of that stuff was separate. And through that, we're able to examine that data collected, and it assists us in improving and addressing issues related to some of the goals that we have. Next slide, please. So we have key messages through CHANT. And again, those key messages are centered around the patient and a family-centered assessment to identify and address those risk factors. We have data-driven care coordination, assistance with navigating complex systems. Again, we're in all 95 counties, and we have care coordinators in all of those 95 counties. We have care coordination models. Another one of our key messages is the reimbursement for medically related services for children and youth with special healthcare needs. And we'll talk more in depth about that later. And our last key message is families and individuals are connected to available community resources such as behavioral health, child development, housing, dental, medical homes, family planning, employment, emergent needs, etc. Next slide. So some of our biggest achievements that we had since we integrated in 2018. I'm not sure if you all are familiar with Find Help, but we participated in a pilot with CHANT staff in Hamilton County, and of course that's the Chattanooga area and several mid-Cumberland counties, and it laid the groundwork for the Tennessee Department of Health implementation of that. Now, the good thing about Find Help is that it assists with finding social services in Tennessee for non-medical needs, right? It's a platform used for making referrals and also tracking the outcomes, which we know is so important because a lot of organizations not only want to make their referral, but we want to know what happens with that family. And Find Help is a platform that allows us to do so. And I'm happy to report that CHANT was a major partner with that pilot. We also have had the achievements of early hearing and detection intervention partnerships within the Department of Health. Our team members have followed up with families that are lost to contact after those newborn hearing screenings. And to date, CHANT has received a list of 413 families who needed follow-up. 40% of those families were contacted, and 6 have been enrolled in CHANT, and 23 new families have been enrolled after the contact. So we're excited about that, and we're also extremely optimistic that this number will continue to grow. And lastly, one of our last achievements with CHANT is the partnership with MCOs and TennCare. And this has contributed to several outreach events, and it continues across the state, resulting in those increased referrals for CHANT. All right, next slide. A couple more of our achievements, a CHANT Collaborative. This is an organization within our department, but we also have outside partners that participate with us. We meet quarterly. Again, it's comprised of CHANT staff and our external and internal partners, and we work on program improvements such as to our systems, our marketing, so folks can come with ideas of anything where they see where CHANT may not be marketing a specific area or has a specific message, and that collaborative helps us with those things. Evaluation planning and identification of community resources. Our trainings, our staff recently participated in the Be Smart gun safety training, and we've established a partnership with the Tennessee Safety and Homeland Security to assist in providing families with those needed gun locks. And of course, we know how important that is to prevent those accidents that we do not want to see, especially in this state. A new initiative that I'm extremely excited to report to you guys is a pilot, for a maternal and infant project. We're currently conducting it in 10 counties that has been identified with the highest rates of SIDS and maternal mortality. And we are currently assisting families in receiving those needed newborn maternal health items through a partnership with Walmart. We're doing that to ensure safe sleep, reduce pregnancy, infancy, postpartum stresses, and positively impact the overall maternal and infant health. And moms have really responded in a positive manner to this, and we're just excited about this partnership with CHANT. Next slide, please. And of course, anyone can make a referral. You guys, a neighbor, a church member, a provider, of course. And so this is the scan code for that, or you can email Kristen Gentry for that information. And I do want to share one of the a statement that one of our care coordinators made for CHANT. I believe the purpose of CHANT is to empower individuals and families in our community who are at risk for poor health outcomes, and CHANT exists to offer support, guidance, and resource linkage to those high-risk populations by developing relationships built on trust and understanding. So I've shared this information with Christine and company, and they can also share this QR code with you guys so you can continue to make those referrals to CHANT. All right, next slide, please. Now getting into the Children's Special Services, or the CYSHCN component of what CHANT is. And if you guys recall, I mentioned CYSHCN on the first slide before I introduced either CHANT or CSS. But CYSHCN, again, we love our acronyms. It stands for Children and Youth with Special Healthcare Needs. And those are defined as children who have or are at risk for chronic physical, developmental, behavioral, or emotional conditions, or who also require health and related services of a type or amount beyond that is required by children in general. CSS, again, falls under that umbrella. And the program is responsible for assisting those via care coordination that meet eligibility standards with a qualifying physical diagnosis. The difference between Children's Special Services or CSS with CHANT is that for CSS, a family must qualify and meet eligibility standards, and they must have a qualifying physical diagnosis. So for CHANT, a family can have a physical, developmental, behavioral, or an emotional condition. But for CSS, a family, we only cover those physical conditions like heart disease, a hearing disorder, cerebral palsy, individuals that has an visual disability. So for CSS, again, it must be physical. Next slide. So what are the eligibility requirements for CSS? First of all, you must have a qualifying physical diagnosis, and that is determined once the person completes an application. Also, another difference between CHANT and CSS is that for CSS, the completion of an application is necessary to determine eligibility. And that is done through the local health departments. And so you can just refer a family to that local health department, as all of our health departments have a care coordinator. A family must also meet financial qualifications. For CSS, a family must fall within 225% of the federal poverty level to qualify. The applicant must be a resident of Tennessee. I believe that Tennessee has a bunch of neighboring counties. And so, we have people that come into Tennessee that work from Mississippi, Arkansas, North Carolina, Georgia. But unfortunately, that one passed. For qualifying on CSS, you must be a bona fide resident of Tennessee. And again, you must be 0 to 21. CSS does have an age requirement, and so you cannot be over the age of 21. And here in this box to your right here, we wanted to show you some of the stats of what we cover for CSS, again, with the poverty levels indicated as well. Next slide, please.
Well, Kathy, can you explain a little bit more about the poverty level? I'm not sure like what the cutoff is for income for that.
Yes. Again, it must be between 225% of the federal poverty level. And so we will take a family's last check stub. We must include everyone from the household that is related to the child. Now, if a family is over, to assist them, we will utilize something that we call a spin down, where if there is anything purchased for anyone in the household for a medical reason, if they can show receipt of that purpose, not only the bill, but the receipt of that purchase for anyone in the household, we will utilize that and we will subtract that from that family's annual income to try to make sure that this family qualifies for the program. Now, just to give a little more in-depth picture of the federal poverty level, almost half of the individuals on CSS, right at 49%, are at under 100% of the federal poverty level, 35% falling between 100 to almost 200% of that, 15% is at 200 to 225%, and we have 1% of the supplemental security income. That 15% for CSS is absolutely huge, as in 2020, the federal poverty level went up to 200%. We increased that because we wanted to assist more families. And again, I'm proud to report that 15% of our families fall within 200 to 25%. So 5 years ago, these are families that we wouldn't have been able to assist. But now, because we increased that, we are able to assist those families.
Okay, thank you. I appreciate that.
Next slide. So how are we able to pay for these things through CSS? And of course, we have a delegated authority. And the purpose of that is to provide that medical and ancillary services to participants in the CSS program. The amount that we have currently is 2.5 million, and that is statewide. I wish that we could have 2.5 million for Shelby, 2.5 for Knox, 2.5 for Davidson and Chattanooga and Sullivan County, but that is not what we have. And so, as you can imagine, the money does go quick for all of these needs. But again, this is a service that would not be here if it was not for CSS, but it is at 2.5 million statewide. We provide a maximum annual allowable for good and service, and we have categories. Say, for instance, a family does have limits because, of course, we provide services for so many individuals, so we have to put a cap on certain services. So that is how we differ from insurance. CSS, a lot of providers and partners call us insurance, but we are not insurance because we have a cap. So you can actually max out for a service, and I'm going to discuss that later in the presentation. We do have vendor requirements. So kind of like insurance, you must be in the CSS network. You have to complete that vendor agreement, and families must go to those providers that have a vendor agreement, and our vendors have to sign that letter of agreement. And they usually, well, they are required to stay a vendor for CSS for 3 years. Next slide, please. Through that delegated authority, we are able to provide interpretations, visual aids or glasses, durable medical equipment, wheelchairs, walkers, things of that nature, special food and formula, inpatient hospital services, outpatient hospital services, and of course, something that I really want to make sure that we're sharing with our families is CSS is also able to assist with co-pays, deductibles, and co-insurance. So say, for instance, you guys have a family member, a neighbor, or you receive a referral from someone, and they have that insurance, that private pay insurance, and they have a kid with a special health care need. CSS is able to even assist those families with those co-pays, deductibles, and co-insurance, especially those families that may have a high deductible. CSS may be able to assist those families with some of the needs that they have. Next slide. Again, with that diagnostic eligibility determination, they must have a qualifying diagnostic condition. We can either confirm that through the medical records or send a form that we utilize called the PH 4212, and the provider must complete that, not the parent, but the provider must complete that. And again, each record, medical record or that PH 4212, must be obtained from the primary care provider, their specialist, or any other medical professional. Next slide. Non-covered services. Of course, we indicated that we don't pay for developmental, emotional, those type of conditions. And so they would also exclude the psychiatric treatment, alcohol and drug treatment, abuse or dependency. Unfortunately, drug treatments will not be covered unless the drug is also FDA approved and prescribed for their diagnosis. So the drug must be FDA approved. And CSS, unfortunately, also does not assist with over-the-counter medications, and supplements usually are not covered by CSS. Sometimes, and I use the word usually, sometimes we do have a situation where an over-the-counter medication may be provided, and that requires special approval from the CSS program director. Next slide. And again, we are always open for referrals with CSS. I am Kathy Robinson, the program director, and that is the referral link to CSS. And we're hoping that you guys will make referrals to CSS, but not only CSS, but to CHANT as well. We really want to make sure that we're assisting our families in the state. It always shocks us when we have meeting with partners, internal and external, and they are not as familiar with the program. So that is why we're doing this. And again, thank you, Serena and Christina, for having us. We are always excited to talk about this program. That's all that I have. And if there are any questions, I am more than happy to answer those.
Hey, Kathy, this just really makes me think about those families that may be in Tennessee's early intervention from birth to 3 or birth to 4, and how critical it might be to, see if they qualify for this after they age out of TEIS, just to ensure that they have that continuity if there is a medical diagnosis. So that was just a good reminder to keep that in mind if you're transitioning from TEIS, seeing if that family might qualify for CSS would be good.
That is an absolute great statement. For those individuals that fall within that age range, it is a requirement for CSS to make their referral. One thing that I did omit from this presentation, that CSS is a payor of last resort. We only have that 2.5 million, and again, it doesn't go that far. So if there is possibly another payor, CSS makes their referral. So if anyone falls within a certain age bracket and has that physical need, it is required to make that determination to TEIS. And yes, when individuals age out, of course, there are times where the need is still there, or some families just need that extra support. And I don't want to say handhold, I would just say that extra support. So when they age out of TEIS, CSS is more than capable of continuing that, like you said, that continuity of services and support with that family. So yeah, we would love to have those referrals.
And there probably wouldn't be any duplication, right? So like a family couldn't have TEIS and CSS at the same time. They would have to pick one or the other.
They can actually have both.
Okay.
Yeah, but again, if TEIS is with the family, CSS will not be able to assist with any payments, but you can still be on the program. For instance, if there's anything that we can assist with that TEIS may not be able to, that's where CSS will come in, because we see that with insurance companies, believe it or not. There are times with insurance companies will not pay for a certain service or something that's needed. But if the provider says that, hey, we really need this child really need this for whatever reason, CSS may be able to pick up. And so that's why I always encourage families to be on CSS, even if you do have private insurance, because there may be something along the lines that your insurance may not pay for, or that is, exempt. And so, of course, if a provider identifies that as something that is needed, CSS may be able to help.
Okay. And do you have a wait time for, like, if somebody's trying to get like AFOs or any kind of medical equipment, how long that typically takes to get approved through your process?
Our approval time has a max of 90 days. But there are some locations that can get it done quicker. Of course, our areas that are heavily populated, of course, the Davidson counties, the Shelby counties, they typically get you approved like maybe right at 80, 70 days. It just depends on, if the medical records are there. Because if a family completes the application and, there are times when the provider's offices don't submit the medical records as soon as we would like. So that may impact how quick your application gets approved. But it just depends on the location and all those different factors that go into being approved.
Okay. And do you have a wait at all for CHANT services, or what's your capacity for CHANT right now across the state?
CHANT, we have a requirement to CHANT, we have a requirement to contact the family, and this is with CSS too. We must contact that family within 10 days of their referral being made. CHANT, usually within that 10 days, we can get you right onto the pathway to help you with what you need. So it is a little bit faster because, of course, you don't have the application process. And hey, with some families with CHANT, we get those referrals and the family may only need a resource. And so then we can provide that family that resource and then close it. But with CSS, because, we're paying for things, that process is a little more stringent. CHANT is a more so like a resource and referral, so they can operate quicker than what Children's Special Services does.
Okay, thank you. Mm-hmm. Does anybody else have any other questions?
So all good questions, Christina. Thank you.
Mm-hmm. Well, I see Serena has put the link in the chat. If you'd like to get credit for today's presentation, please complete that. We value your input, and any feedback that you have or any ideas for future training, please let us know. And thank you for joining us today.
Thank you guys again for
having me. Thank you, Kathy, again.